Good afternoon, everybody. Sorry for being a little late. We'll wait a little bit longer and see if anybody joins us. If not, we will just keep trucking along. Good afternoon, Christine. Good afternoon, Tammy. Happy to always have you guys. Thanks for joining us. I know it's summertime and everybody has lots of fun plans with family, so appreciate both of you joining us. And then we'll see if anybody else joins. Okay, we'll just get going, and then maybe today's will be a little shorter. So next slide, Rukia, please. So I think it's safe to say Japan is on a downward trend, which is great, especially with the Olympics coming up. So the world could use some good news. Next slide. South Korea staying steady, but once again, if you look at their 70 average versus Japan, Japan is a little over 2,000, South Korea is 600. So not doing too bad. And it's important to remember that both Japan and South Korea are not even close to the vaccination levels that we are at in terms of the state and the United States. Next slide. India, thankfully, as well, going down. Still 70 averages over 100,000. So, everything is relative. They're doing awesome, but still way more than the rest of the world. Next slide. I mean, if you look at this, it's awesome how much we've truly descended in terms of at a national level on our 7-day case average. It's astounding, and it speaks to the hard work of everybody trying to get the vaccination rates up. Next slide. No major changes to Arizona and California, so hopefully we'll keep seeing this trend continue. Next slide. And also same with Nevada, Texas, so a slight uptick. Once again, we need to wait and see. I'm a little more cautious when it comes to Nevada and Texas because they're a little more open with their policies or lack of policies, and in terms of vaccination rates. And we'll talk about this in our science highlight. Their vaccination rates are not as robust as some of the other states, and it tends to be some correlation with political party. Next slide. So Hawaii overview, doing steady, holding steady in terms of cases per 100,000, positivity rate, understanding that numbers have gone slightly up because of the probable cases, but still doing really well. Percent positivity is the one to look at more because it's relative. Next slide. And then, yep, so Hawaii keeps on doing well. The governor set the mark of 60% and 70% in terms of incentives. Question from Jim. Sorry, Jim, I apologize. I'm on my phone. So does this national view upskill problems with lower vaccination rates in the South? Absolutely. I'm glad you brought that up. I'll talk about that more, Jim, in one of the science highlights. Next slide. No major changes to testing turnaround time. Hopefully, we will never become overwhelmed with testing, like we were early on in the response. Next slide. HiPAM forecast remains flat. No major changes, even as we slowly reopen because of our vaccination rates. Next slide. And then one after that, Rukio. Perfect. So 4 science highlights today. The first one is a really good article done by NPR, and we'll spend some time talking about it. And then a DOH survey, and then an update to some data visualization by the state of Hawaii, DOH, and then a positive update in terms of the Delta variant. So next slide, please. So Jim, to speak to your question, yes, absolutely. If you look purely at a national level, you were missing a lot of the nuances. What this does, and it's not surprising, is also very sad if you look at the bubble charts, where So once again, this is one shot, not fully vaxxed, but the bubbles we refer to percent population that received at least one dose. It's not surprising to see a stark dichotomy on population with one shot by political party, or based on the state, in terms of whether or not they voted blue or red, Republican or Democrat. And that speaks to the fact that a lot of the response has been politicized when and when it shouldn't have. It's science and it's health. Health and science shouldn't be politicized at its core. Unfortunately, it happens too often, but this is a very easily digestible representation of the vaccination rates by political party. And then, obviously the South tends to be more red leaning, so it's not surprising. And if you look at their rates of new COVID cases, I didn't get a chance to try to tease it out in terms of a graph, but I wouldn't be surprised if the South still had, amongst their unvaccinated populations, an epi curve that resembled what we saw last year. Next slide. And then DOH contracted Anthology to do a survey. Some key highlights: 68% of those surveyed received at least one dose of the vaccine. However, there are still some concerns or reasons why they haven't gotten it, safety being the top, along with trust issues. And then 77% of that subset who did not get the vaccine, worried about the efficacy. However, some positive insight of the respondents who have at least one child in their home, majority are willing to get or to let their child get the vaccine as long as it's recommended by the FDA. And that's huge because that's the remaining bulk of our population that has yet to become vaccinated, and we really need the youth to bolster our immunity in terms of our herd immunity. What's telling, and we still have some work, is 36% admitted they have attended a public gathering or 10 or more with no one to formally enforce suggested COVID-19 guidelines. And that's actually surprising. I would have suspected that's a little higher. Next slide. And then, so you can read a summary in the Civil Beat. Does a good job kind of printing it up and making it easily digestible. Next slide, please. And so if you haven't been on the DOH website recently, they have some really neat improvements to their data visualization I wanted to call out. So you can now look at by county and by zip code, I believe, or census tract, the percent vaccination. So, it helps us understand where the gaps are and where we really need to target. It's not perfect, but it's better than where we were 3-4 months ago. And I think that's important to call out that DOH has continued to improve their transparency when it comes to data from the beginning of the response to now, and also better tools and deep dives in terms of the data. Next slide. Then finally, this was published very recently, but and Dr. Fauci called out the results, and it's really good that even with the Delta variant, which is the India variant, at least for the Pfizer vaccine, if you get 2 doses, you have very good protection. However, you need to get both doses. One dose is still only 33% effective against the Delta variant, and what literature has shown is that the Delta variant is more transmissible than even the UK variant, or the I believe that's the Alpha variant. So, but good news, once again, continue to get data to support the narrative that vaccines really do work even against the variants. So with that, that concludes today's highlights. Any other questions, Jim? Hopefully that kind of helped answer. And this is getting the entire nation on the same, up to speed in terms of vaccination rates will continue to be a challenge, especially when a lot of the response is still being politicized. But there's only so much we can do from the scientific perspective. But any questions or comments for today before we close up and let everybody kind of enjoy their summer weeks? Okay. Not seeing any in the chat or in the Q&A. Like to keep it short and sweet. Thank you guys for your time. Hopefully, you guys took away something that you weren't aware of before, and please share all of this with your friends and family. Really appreciate your continued support. I know our numbers are kind of thin sometimes, but you know, at this point, people are, which is good. People are back to a more normal routine, but we still hope to provide a service. And you know, I think moving forward, where we are adjusting our strategy. So look out to see how HiPAM is going to evolve moving forward. So thank you all. Have a great rest of your week. Be safe, and we'll see you guys next week. Take care, everybody. Aloha.